Your body isn't falling apart because of age. Your joints are breaking down because of years of poor movement, compensation, and misalignment issues. You see, pain is just a signal. It's a warning sign. It's not the death sentence. If we treat the pain without addressing these patterns, we miss the whole point. Just like tires wear unevenly in your car because they're out of alignment, your knees begin to break down when those forces placed on them aren't balanced. Biomechanics is a study of how the body moves. See, when your body is functioning properly, your joints, they work in harmony. Welcome back to the Freedom Health Show. I am Dr. Matt Gianforte, and I'm excited to be here with you today because we've spent the last 2 episodes unpacking a major issue here in America, okay? And this is joint pain and how back pain, knee pain is handled in a reactive manner versus a symptom-focused way. From over-the-counter drugs to cortisone injection and then finally joint surgery, the standard model rarely asks one important question. Why did the joint start breaking down in the first place? Today we're going to answer that question, and it might change your view of knee pain or back pain or shoulder pain. Because the truth is, the primary driver of the chronic joint pain, the knee problems, isn't aging or arthritis. It's a biomechanical breakdown that's happened over your lifetime. This is where most treatment models fail. They address the inflammation and the pain, but not actually the mechanical dysfunctions that cause the symptoms in the first place. So let's dive in. You've probably heard the term wear and tear arthritis, right? It's the go-to explanation for knee pain, especially as we get older. But let's challenge that narrative. If osteoarthritis were simply a function of aging, we'd expect every person over the age of 60 to have the same level of joint degeneration. And we'd expect it to affect both knees equally, but that's not what we see. Most patients have one knee that's significantly worse than the other. Why is that? Because the issue is less about time and it's more about load distribution and movement patterns. See, according to the 2021 review of the Journal of Orthopedic Research, abnormal mechanics loading is one of the strongest contributors to the progression of knee arthritis. In fact, chronic joint stress caused by poor alignment and faulty gait plays a greater role in cartilage degeneration than age alone. Just like tires wear unevenly in your car because they're out of alignment, your knees begin to break down when those forces placed on them aren't balanced. So when somebody says it's just wear and tear, what they're really describing is long-term mechanical dysfunction. And that's something that we can address, that you need to address as that pain starts to develop. So let's break down what it means by biomechanics. Biomechanics is a study of how the body moves and how forces are distributed through those joints. See, when your body is functioning properly, your joints, they work in harmony, absorbing shock, distributing weight, and stabilizing movement. But if something is off, whether it's a weak glute, a collapsed arch, a tilted pelvis, or poor posture, your knees start to compensate. And it's that compensation, repeated thousands of times every day, that begins to wear down the joint. A study in gait and posture found that altered gait mechanics can increase knee adduction torque and improper foot strike. Okay, so what is this? Well, this is directly linked to a faster joint degeneration in people with knee arthritis. Another study in arthritis care and research showed that strengthening hip abductor muscles alone significantly reduced knee pain, improved joint function. Why? Because the hips play a crucial role in knee movement. So these findings are something that we see clinically in practice all the time. The pain isn't always where the problem started. You might feel pain in your knees, but the root cause is actually in your hip, your ankle, or even in your low back. This is why we always ask patients with knee pain, tell us the last time you had ankle pain or low back pain. That's why when people come in with low back pain, we ask them, hey, when was the last time you had knee pain or hip pain? Or when was the last time you had mid-back or neck pain? Because everything is interconnected within the body. If we never identify those biomechanical faults, really not ever going to create a lasting change in just short-term relief. So when patients come in to us with chronic knee pain, our first step is to perform a comprehensive biomechanical evaluation. We analyze gait patterns, weight distribution, joint range of motion, muscle activation, core and hip stability, posture and alignment from head all the way down to your toes. We're asking, where is the mechanical breakdown occurring and how is it impacting the knee? We combine this evaluation with tools like posture scans, manual muscle testing, functional movement assessments, from where we build a corrective plan that often includes chiropractic care to realign the spine and pelvis, physical therapy to restore posture movements, neuromuscular re-education to wake up the right muscle groups, targeted strength training to reinforce stability, and in some cases, regenerative therapies to support tissue repair. And when we address these mechanical issues, pain often begins to decrease, even in patients who've been told that their knees or their joints or shoulders or back are bone on bone. How many times have you been told that? You see, when we stop the abnormal stress, we stop the breakdown, and the door opens then for healing. So the big message here that I want you to leave with today is your body isn't falling apart because of age. Your joints are breaking down because of years of poor movement, compensation, and misalignment issues. Things that can be addressed, improved, and even reversed. You see, pain is just a signal. It's a warning sign. It's not the death sentence. If we treat the pain without addressing these patterns, we miss the whole point. But when we restore the mechanics, we give the body the permission to heal. See, in our next episode, we're going to talk about how to actually rebuild and restore that joint health. We're going to look into the cutting-edge regenerative therapies, nutritional protocols, and movement strategies that help patients preserve their knees, avoid surgery, and get their life back. If you're ready to start the process, visit us at lifeworkskc.com or call the office. Schedule a discovery call with our staff to see if this is something that would be a good fit for you. The reality is, it's never too late to start correcting the mechanics and start getting on the right page again with your joints. Arthritis is a chronic disease in our country, and it can be stopped. It can be stopped and slowed down. So thank you for joining me today on the Freedom Health Show. I'm Dr. Matt, and you can always check us out on Apple or Spotify podcasts. Subscribe to it. Don't miss an episode because I'm always giving little tips and tricks. And remember, half of health is just changing the way you think about it. Because if you can think a little bit differently about health, about how your body reacts and getting different perspective on things, you can start making better choices. Until next time.